Fundamentals Chapter 11. Hair Removal. Learning Objectives. After completing this chapter, you will be able to explain the importance of hair removal, describe the structure of hair, explain the hair growth cycle, identify the causes of excessive hair growth, compare temporary and permanent hair removal and reduction methods, explain when to use hard and soft wax methods of hair removal, provide a thorough client consultation for hair removal services, list items needed in a wax treatment room, demonstrate waxing head to toe with soft and hard waxes, explain the importance of hair removal. Consumers in the United States spend millions of dollars per year on hair removal products and services. Today, hair removal methods range from procedures such as waxing and tweezing, to more advanced techniques that require special training, like electrolysis, laser, and intense pulsed light (IPL). Face and body hair removal has become increasingly popular as evolving technology makes it easier to perform with more effective results for both men and women for aesthetic purposes or sport performance. Estheticians should study and have a thorough understanding of hair removal because the growing popularity of hair removal makes up a large part of a salon's business and is one of the most lucrative services offered. Figure 11.1. Hair removal makes up a large part of an esthetician's business. Waxing is the most common method of hair removal in salons, making it an important service to learn, become proficient in, and provide. Understanding the benefits, the risks, and how to perform various techniques is vital to an esthetician's success in this profitable market. Knowing what methods are used, room preparation, safety, and infection control procedures are an important part of hair removal procedures. Describe the structure of hair. The scientific study of hair and its diseases is called trichology. The average human is born with skin that houses approximately 5 million pilosebaceous units capable of producing hair. It is important to understand all aspects of hair, including its structure, its appendages, and the types of hair found on the body. This will help you to suggest and provide the best hair removal services to your client. The hair follicle and its appendages. A hair follicle is a mass of epidermal cells forming a small tube, or canal, figure 11.2. Follicles extend deep into the dermis. The pilosebaceous unit contains the hair follicle and its appendages, which include the hair root, hair bulb, hair papilla, hair shaft, and the erector pili muscle and sebaceous glands. Figure 11.2. The structure and appendages of hair. Follicular canal. The follicular canal is lined with epidermal tissue. These epidermal cells produce the follicle and hair matrix. The matrix is where cell mitosis, division, happens. Hair root. The hair root anchors hair to the skin cells and is part of the hair located at the bottom of the follicle below the surface of the skin. The root is part of the hair that lies within the follicle at its base, where the hair grows. Hair bulb. The hair bulb is a thick, club-shaped structure made from epithelial cells that surround the papilla. This forms the lower part, or base, of the hair follicle. This is where hair grows from cell division. The lower part of the bulb fits over and covers the papilla. The hair bulb contains the dividing cells of the hair matrix that produces the hair and both the external root sheath, epidermal tissue, and internal root sheath lining the follicle. The external root sheath is made of horny epidermal tissue. The internal sheath is the innermost layer of the follicle, closest to the hair. The internal sheath is the thick layer of cells you see attached to the base of a hair when epilating it. Hair papilla. The hair papilla, plural, papillae, is a cone-shaped elevation of connective tissue that contains the capillaries and nerves located at the base of the follicle that fits into the bulb. Hair papillae are necessary for hair growth and nourishment of the follicle. The blood vessels bring nutrients to the base of the bulb, causing it to grow and form new hair. Sensory nerves surround the base of the follicle. Hair shaft. The hair shaft is defined as the part of the hair located above the surface of the skin. As cell division within the hair matrix occurs, the hair grows and gets longer. Keratinization is complete by the time these cells approach the skin's surface where the hair shaft protrudes from the skin. This is similar to skin cell division and migration. Basal cells in the hair matrix divide and form the three main layers of the hair shaft: the cuticle, cortex, and medulla. The cuticle is the outermost layer, the cortex is the middle, and the medulla is the center, or innermost, layer of the hair shaft. The two outer layers of the shaft are hard keratin and the inner layer is soft keratin. Sebaceous gland. The sebaceous gland secretes the waxy substance called sebum, which lubricates the skin and hair. This helps keep skin supple and waterproof and protects against external factors. Erector pili muscle. The erector pili muscle contracts when affected by cold or other stimuli. It pulls on the follicle and forces the hair to stand erect, causing goosebumps. This reaction is also thought to keep skin warmer by creating an air pocket under the upright hairs. The muscle contraction also helps disperse the protective lipids from the sebaceous gland to the skin and hair. List the types of hair. There are three major types of hair to be found on the human body: lanugo, vellus hair, and terminal hair. Lanugo. Lanugo is soft downy hair found on a fetus. The lanugo hair sheds after birth and is replaced with either vellus or terminal hair. Vellus hair. Vellus hair is found in areas that are not covered by the larger coarse terminal hairs. For example, vellus hair usually grows on women's cheeks, also known as peach fuzz. Removing vellus hair, especially against the hair growth, can result in the follicles producing new terminal hairs, so it is not recommended to tweeze, shave, or wax these fine hairs. Terminal hair. Terminal hair is the longer, coarse hair found on the head, brows, lashes, genitals, arms, and legs. With hormone changes during puberty, follicles are naturally regulated to switch from producing vellus hairs to producing terminal hairs in these areas. Check in. What are hair papillae necessary for? What is the benefit of the erector pili muscle? What is the difference between lanugo and vellus hair? What is the main catalyst for vellus hairs transitioning to terminal hairs? Explain the hair growth cycle. Hair growth is a result of the activity of cells found in the basal layer. These cells are found within the hair bulb. Hair growth occurs in three stages: anagen, catagen, and telogen. These stages vary in duration on different parts of the body. For example, scalp hair has a longer anagen phase, so the hair on the scalp can grow down to the knees in some cases. Conversely, eyelashes have a relatively short duration of the anagen phase before shedding and being replaced, which is why we do not need to get our eyelashes trimmed. These cycles can also be determined and affected by many factors including age, genetics, hormones, and a person's health and prescription drugs. Use the acronym ACT to remember the growth stage sequence. Hair follicles in any given part of the body will be in different phases at any given time. Figure 11.3. Hair growth occurs in three stages known as anagen, catagen, and telogen. Anagen phase. The anagen phase is the growth stage during which new hair is produced. New keratinized cells are manufactured in the hair follicle during the anagen stage. Activity is greater in the hair bulb, which pushes down into the dermis and swells with cell mitosis in the matrix. Stem cells at the junction between the erector pili muscle and the follicle grow downward and stimulate cell mitosis in the matrix. New cells form hair and root sheaths while the older part of the hair is pushed upward. Once hair has reached its full length, it can remain there for weeks or years, depending on its location on the body. Hair on the scalp remains in the anagen phase for years. Other areas, like eyelashes, have a short anagen phase. The length of the anagen phase determines the length of the hair. This stage is the most important stage for estheticians in effective hair removal, as removing hairs during the anagen stage will be more effective for long-term hair reduction. Catagen phase. The catagen phase is the transition stage of hair growth. In the catagen stage, mitosis ceases. The hair, having completed its growing phase, detaches itself from the dermal papilla. The follicle degenerates and collapses as epidermal tissue retracts upward. Hair loses its inner root sheath and becomes drier. The mature hair is now referred to as a club hair. The base looks like a club. This is the shortest part of the hair growth cycle. Telogen phase. The telogen phase is the final, or resting, stage of hair growth. During the telogen stage, the club hair moves up the follicle and is ready to shed. The hair is at its full size and length and is erect in the follicle. It is clearly visible above the skin's surface unless it has already shed. The hair bulb is not active, and the hair is released and is attached only by epidermal cells. Hair may sit in the follicle until it is pushed out by a new anagen hair or falls out on its own. In some cases, the hair may share the follicle with a new anagen hair, giving the appearance of two hairs coming from a single follicle. The empty and dormant follicle is latent until the cycle begins again with a new anagen phase. Check in. What is the most effective stage for hair removal? What makes scalp hair grow longer than eyelashes? Identify the causes of excessive hair growth. The amount of hair an individual has differs from person to person. What would be normal hair growth in one person might be extreme in another. Hair growth, in terms of density on the scalp, face, and body, is determined by genetics and ethnicity as well as health and hormonal influences. It is important to recognize the differences when assessing the client for hair removal services. Hypertrichosis versus hirsutism. Hypertrichosis is an excessive growth of terminal hair in areas of the body that normally grow only vellus hair, lower back, eyelids, abdomen, and not necessarily in the adult male, hair growth patterns. This type of hair growth is genetically and ethnically inherited but can also occur due to natural life occurrences, example puberty, pregnancy, and menopause, certain medical procedures and treatments, example cancer, or reactions to certain medications, example steroids. It is not stimulated by male androgens, and while there may not be a cure to address the cause of the superfluous hair, it may be treated aesthetically. Figure 11.4. Areas of the body prone to hypertrichosis. Hirsutism is excessive hair growth on the face, chest, underarms, and groin, especially in women. It is caused by excessive male androgens in the blood. This hormone imbalance may be caused by stimulation of male androgens at puberty, medications, illness, and stress. It can be resolved by eliminating the cause of the condition. Excessive hair growth on a female face or body may be attributed to hormonal imbalances and excessive androgen production secreted from the ovaries or adrenal glands. Menopause may also cause excessive facial hair. These changes may dissipate with time and medical attention. Figure 11.5. Areas of the body prone to hirsutism. Common diseases, disorders, and syndromes affecting hair growth. Excessive hair growth may indicate a medical issue, and there are a number of documented diseases, disorders, and syndromes that, when diagnosed and treated, can reduce the problem of hirsutism. A disease is pathological, like conditions caused by viruses and bacteria, with a series of signs and symptoms. A disorder is an abnormality of function, like a birth defect or genetically inherited malfunction. A syndrome is a group of symptoms that, when combined, characterize a disease or disorder. Diseases affecting hair growth. Medical conditions related to excessive androgen production that affect hair growth are acromegaly and Cushing syndrome. Disorders affecting hair growth. Adrenogenital syndrome is a malfunction of the adrenal cortex that causes an overproduction of androgens. Syndromes affecting hair growth. The most notable and prevalent syndrome relating to hair growth is polycystic ovarian syndrome, COS, formerly known as Stein-Leventhal syndrome. An individual with this syndrome would present with hirsutism, irregular menses, ovarian cysts, and obesity. Another notable syndrome is Achard-Thier syndrome, which is a combination of Cushing and adrenogenital syndromes. Focus on common and current medicines affecting hair growth. Medications causing hirsutism. Anabolic steroids. brevican, norethindrone and ethinyl estradiol. Cyclosporin, Axarid. Resticis, cyclosporin. Danazol, Danacrin. Prednisone, corticosteroid. Provera, medroxyprogesterone acetate. Premarin, conjugated estrogens. Tagamet, cimetidine. Tamoxin, tamoxifen citrate. Medications causing hypertrichosis. Clomid, clomiphene citrate. Cortisone, cortone acetate. Dilantin, phenytoin. Loestrin, norethindrone acetate, ethinyl estradiol, ferrous fumarate. Rogaine, minoxidil. Proglycem, diazoxide. Provera, medroxyprogesterone acetate. Check-in. What disease, disorder, or syndrome most commonly causes hirsutism? Between hirsutism and hypertrichosis, which is attributed to genetics and not male androgens? Compare temporary and permanent hair removal and reduction methods. Methods of hair removal fall into two general categories, temporary and permanent, including permanent reduction. Temporary hair removal involves repeat treatments as hair grows. With permanent hair removal, the papilla is destroyed, making regrowth impossible. Spa and salon techniques are generally limited to temporary methods such as waxing, sugaring, and threading, and some may offer electrolysis as a permanent method of hair removal. Some states allow laser and IPL hair removal that offer permanent reduction. Medical spas, or medi-spas, with physicians on staff offer laser and IPL hair removal, but rarely temporary methods. Temporary methods, home and professional. Temporary methods of hair removal include depilation and epilation. Depilation is a process of removing hair at or near the level of the skin. Both shaving and chemical depilation are included in this category. Another temporary method of hair removal is epilation, the process of removing hair from the bottom of the follicle by breaking contact between the bulb and the papilla. The hair is pulled out of the follicle. Tweezing, waxing, sugaring, and threading are all methods of epilation. Figure 11.6. The effects on the follicle from different types of hair removal. Tweezing and electronic tweezing. The method of using tweezers to pull hair out by the root one at a time is called tweezing. Eyebrows can be shaped and contoured by tweezing. Tweezing is also used on remaining hairs after waxing. If clients are sensitive to waxing, tweezing is a slower, but effective, alternative for removing the dark, coarse hair on the face. Another less common tweezing method used is the electronically charged tweezers. The tweezers are used to grasp a single hair and transmit radiofrequency energy down the hair shaft into the follicle area. The idea is that the papilla is desiccated and eventually destroyed. However, the efficacy of this method is controversial as the hair is not a good conductor of heat or radio frequency. Electronic tweezers are not a method of permanent hair removal, and the process is slow. Separate licensing may be required to perform electronic tweezing in some states. Tweezing pros. Minimal cost after purchase of good pair of tweezers. Convenient to use. Tweezing cons. Can be uncomfortable, even painful. Eyeglasses impede tweezing. Poor vision makes it difficult. Time-consuming and laborious for clearing dense growth. Only feasible in small areas. Hairs broken with tweezing can create bumps and pimples. Perform. Procedure 11:1. Perform eyebrow tweezing. Shaving. With shaving, as with any depilation method, the hair is removed down to the skin's surface. It may appear that hair is growing in thicker and darker after shaving, but that is because the fine tip of the shaft is removed, and the thicker part of the shaft is visible as it protrudes. The protruding cut hair feels coarse to touch. Shaving the terminal hair on a woman's face could be problematic as vellus hair would also be removed, and repetitive shaving stimulates terminal regrowth, especially with the onset of menopause. Additional problems are the potential for PFB, or pseudofolliculitis barbae, which is a term for razor bumps, rash, and ingrown hairs, and folliculitis, which is an infection of the hair follicles. Both these problems can be corrected by using clean razors, not shaving so close that the cut hair drops underneath the skin, and not changing the direction of shaving. Shaving pros: inexpensive, convenient, fast, painless. Shaving cons: causes stubble hair growth in 1 to 4 days. Vellus hair also removed when terminal hair on the face shaved. May cause folliculitis, PFB, and ingrown hairs. May cut skin. Chemical depilatory. A depilatory is a chemical substance spread on the skin to dissolve the hair at the surface of the skin and just below the stratum corneum. On contact, the hair expands and the disulfide bonds of the hair, protein and cysteine, break, and the hair can be wiped or washed away. The active ingredients are alkaline such as sodium hydroxide, potassium hydroxide, thioglycolic acid, or calcium thioglycolate. Although depilatories are not commonly used, you should be familiar with them in case your clients have used them or are using them. If the depilatory is left on longer than recommended, perhaps to try to dissolve coarse terminal hair on the face, dermatitis could result. So as with any home care method, it is important to follow the manufacturer's recommendations and instructions. Depilatory pros: relatively inexpensive, though costlier than shaving. Can be conveniently applied in privacy of own home. Regrowth is slower and softer than that of shaving. Depilatory cons: results not as long-lasting as waxing. Strong odor during chemical processing. Can cause irritation and later reactions such as contact dermatitis because the skin's natural protective barrier is compromised as the depilatory is removed. Should not be used on non-intact skin. Threading. Threading is an ancient method of epilation that began in the Middle East and is now rapidly spreading throughout the Western world. Threading, threading, also known as banding, works by using cotton thread that is looped and twisted in the middle, then quickly and selectively guided along the surface of the skin, snagging the unwanted hairs in the twisted portion of the thread and epilating them. Its effect is tantamount to mass rapid tweezing. Figure 11.7. Example of threading. Threading can be accomplished using a two-handed technique or a hand and the mouth. The two-handed technique uses a closed loop and cat's cradle technique where each end is looped around the thumbs and forefingers. The thumb and forefinger of each hand alternately open and close, moving the twist forward and backward. The hand and mouth technique, which should not be performed as a professional service, loops the thread around the thumb and forefinger of one hand. The other thumb and forefinger grip a loose end, and the other loose end is placed in the practitioner's mouth and gripped by the teeth. The practitioner uses their head to maneuver the piece of thread. Licensing and regulations for threading may vary from state to state. Threading pros: fast, inexpensive method of hair removal. Requires minimal products and supplies. The thread is discarded after use, so it is hygienic. It can be performed on clients whose skin cannot tolerate waxing. Threading cons: it can be painful as hairs are snagged in clusters. It should not be performed on vellus facial hair as it distorts the follicles, stimulating them to produce terminal hair over time. It may cause some redness and irritation. Can cut hairs, causing bumps and breakouts. Sugaring. Sugaring is another ancient method of hair removal, dating back to the ancient Egyptians. It is an alternative for those who have sensitive skin or who react to waxing with bumps and redness. The original recipe is a mixture of sugar, lemon juice, and water, heated to form syrup, which is then molded into a ball and pressed onto the skin and quickly stripped away. The sugar can be used over and over on the same client until the hair left in the product interferes with the process. Then it is discarded. Sugaring is similar to waxing methods except that it uses a thick, sugar-based paste and is especially appropriate for more sensitive skin types. One advantage with sugar waxing is the hair can be removed even if it is only 116 to 18 inch, 1.5 to 3 millimeters, long without adhering to the skin. It can be removed in the direction of the hair growth, which is less irritating than waxing. It can be used for some who have certain wax contraindications. Sugar mixtures are now manufactured in large quantities and sold in small containers ready to be placed in a heater. The sugar mixture melts at a very low temperature. It is hygienic because it is used on a specific client and then discarded. True sugar products should be natural and resin-free. Additives in the formula will change the results and effects on the skin. Sugaring uses both directions of applying and removing the product, with the hair growth and against the hair growth. The application and removal depend on the product and the manufacturer's instructions. There are two types of sugaring methods. Hand applied. Spatula applied. Hand method. With the hand method, the product is held in the hand and applied against the hair growth and removed in the direction of the hair growth. Figure 11.8. The application is similar to hard wax. The hand-applied method is performed at body temperature, 98 F°/37 C°. Figure 11.8. Hand-applied sugar paste. Hand-applied sugaring pros. There is no risk of burning because it is applied at body temperature. There is minimal risk of bruising as it does not adhere to skin and pull during removal. Sugar paste manufacturers consider that the lower temperature and minimal adhesion to skin make it possible to apply over varicose and spider veins, dry psoriasis, and dry itch eczema. Caution and good judgment should be used. The same area can be gone over more than once during the service without the risk of causing irritation and trauma. It is considered safe to use on people with diabetes, however, a physician's approval should be obtained and a medical release signed. Hair length need be only 116 inch long for removal of virgin, previously untreated, hair. No hair follicle distortion or breakage of hair because it is removed in direction of growth. Regrowth hair is lighter, softer, and less dense. Easy cleanup for the client. Naturally antiseptic properties inhibit bacterial growth. Hygienic as the sugar paste is not reused on other clients. Easy cleanup of equipment, room, and treatment table as it is water-soluble. Inexpensive if homemade. Hand-applied sugaring cons. Slower and more time-consuming to perform than soft wax, especially on larger areas. Some minimal discomfort similar to, but not as uncomfortable as, waxing. Not suitable for precise hair removal in areas such as eyebrows. Folliculitis and ingrown hairs possible, although considerably less with this method than with both the spatula-applied method and waxing. Spatula-applied sugaring method. The product is applied with a spatula in the direction of hair growth and removed against the hair growth with muslin or pellin strips. The spatula-applied method is warmed according to manufacturer's instructions, as it may be affected by additives like resins. Figure 11.9. Spatula-applied sugar paste. Spatula-applied sugaring pros, if sugar paste has no added resins. Reduced risk of burning because it is applied at a cooler temperature than hot wax. Faster service than the hand-applied method as larger applications are made. Minimal discomfort and trauma to the skin. Safe for dry psoriasis and dry itch eczema. The same area can be gone over more than once without the risk of causing irritation and trauma. The hair length need be only 116 inch in length for removal of virgin, previously untreated, hair. Regrowth hair is lighter, softer, and less dense. Easy cleanup for the client. Naturally antiseptic properties inhibit bacterial growth. Hygienic as the sugar paste is not reused on other clients. Easy cleanup of the equipment, walls, floors, and treatment table as the sugar is water-soluble, if resin-free. Spatula-applied sugaring cons, if sugar paste contains resins. Risk of burning if the sugar paste is not tested for appropriate safe-to-use temperature prior to the application. Some discomfort similar to waxing. Folliculitis and ingrown hairs possible. Possible distortion of hair follicles. Waxing. Waxing is the primary hair removal method used by estheticians. Wax is a commonly used epilator, applied in either soft or hard form. Both products are made primarily of resins and beeswax. Honey wax is the most common, to which gum rosin is added. Wax is applied evenly over the hair and then removed. Hard wax is thicker than soft wax and does not require fabric strips for removal. The recommended time between waxing appointments is generally 4 to 6 weeks, dependent on the anagen and telogen phases for the area being waxed, and the percentage of hairs in the anagen phase. Waxing is addressed more fully later in the chapter. Figure 11:10. Wax is applied in either soft or hard form. Waxing pros. Relatively fast and efficient way to temporarily remove unwanted hair. Wax kits and products available for home use. Estheticians, with training and practice, can become speed waxing technicians, cutting the typical service time in half and increasing profits. Shorter waxing time means minimal discomfort to the client. Hair can take 6 to 8 weeks to return. Regrowth is often softer to the touch. Some clients report reduction in hair growth after multiple wax services. Waxing cons. Several contraindications to waxing, especially with soft wax. Rosins in wax adhere to the skin and are a cause of irritation. Risk of irritation and burning due to overheating the wax. Risk of lifting the epidermal layer of skin if the wax is too cool and goes on too thickly. Can be messy until one is skilled with the use of waxing. Hair length of 12-inch for coarse and 14-inch for fine hair is required for removal. Irregular regrowth can occur after multiple waxing treatments, especially when the hair is removed in the direction opposite of hair growth. Poor technique can leave behind up to 30% breakage that will be felt within a few days. Permanent hair removal and reduction. The methods of permanent hair removal and reduction are electrolysis, laser hair removal, and intense pulsed light (IPL). Electrolysis is the only proven method of hair removal recognized and given the designation permanent hair removal by the U.S. Food and Drug Administration (FDA) and the American Medical Association (AMA), as it is an effective method on all hair and skin types. Laser and IPL have been given the designation of permanent hair reduction, as the effectiveness of both of these methods is dependent on the levels of pigment, melanin, in the hair and skin. With laser hair removal, a laser beam is pulsed on the skin using one wavelength at a time, which impairs hair growth. It is an intense pulse of electromagnetic radiation. Electrolysis. There are 3 main modalities that fall under the classification of electrolysis: thermolysis, galvanic electrolysis, and the blend, a combination of the 2 methods applied alternately or simultaneously. Thermolysis uses alternating current, AC, that is applied and emitted from the probe, inserted into the follicle of the hair to be eliminated, to destroy the dermal papilla. Galvanic electrolysis utilizes direct current, DC, from the probe, which creates a chemical reaction of sodium hydroxide, NaOH, also known as Li, to cause decomposition of the follicle. Electrolysis should be practiced only by a professional certified and licensed, if the state requires it, in the field of electrology. If the state does not license this profession, an electrologist should become a certified professional electrologist, CPE, via the American Electrology Association, AEA, or a clinical medical electrolysis, CME, from the Society of Clinical and Medical Hair Removal, SCMHR, which is also the association that supports laser/IPL professionals. Talk with your instructor for additional information about classes and licensing in electrolysis. Figure 11:11. An electrolysis treatment. Electrolysis pros. The only method of permanent hair removal recognized by the FDA. Can be performed successfully on all types and color of hair. Can be used effectively on all skin types, dry, oily, mature, and with all races. Can remove hairs with great precision, one at a time, making it a great choice for shaping the perfect eyebrow. Electrolysis cons. Requires the cessation of other forms of hair removal on the areas to be treated, except for trimming or shaving. More costly than tweezing. Can cause discomfort for some people. Success depends on a commitment to regularly scheduled appointments. Treatments can cause redness, bumps, and swelling. Makeup should not be worn on treated area for 24 hours after treatment. Extensive electrolysis may take months, even years, to complete. Higher Fitzpatrick skin types can develop post-inflammatory hyperpigmentation if appropriate aftercare of sunblock is not applied. Laser and intense pulsed light. Both laser and intense pulsed light offer permanent hair reduction. While these methods are sometimes called permanent, the hair bulb must be destroyed completely or there may be some regrowth. Food and Drug Administration, FDA, guidelines require that these procedures be defined only as permanent hair reduction. The word laser is an acronym for light amplification by stimulated emission of radiation. Lasers use intense pulses of electromagnetic radiation that in the case of hair removal are attracted to, and heat up, pigment that is, melanin, figure 11, 12. The best candidates are those with dark hair and minimal pigment in the skin. Conversely, those with gray hair are the least favorable candidates as the hair would not respond because the laser is designed to target pigment. Fitzpatrick 4 through 6 would be less favorable candidates in comparison to Fitzpatrick I through 3 because the former have increased pigment in the skin and therefore a greater risk of burning and hyperpigmentation. Figure 11, 12. Lasers use intense pulses of electromagnetic radiation to target pigment. Different from a traditional laser, intense pulsed light, IPL, produces a quick flash of light. These short, powerful pulses shatter their target without allowing heat to build up and burn the surrounding skin. Both laser and IPL are normally performed in a medical setting or under medical supervision, although local regulatory agencies regulate who can use these devices. Laser/IPL pros. Both methods offer a fast, long-lasting hair reduction treatment. Treatment may produce some permanent results in hair reduction. Large body areas can be treated with greater speed because multiple hairs are treated at once, unlike the hair-by-hair method of electrolysis. No risk of disease transmission from blood. Not considered as uncomfortable as electrolysis, though this is subjective. Regrowth is often finer in texture and lighter in color. Laser/IPL cons. Costly treatment requiring an average of 3 to 6 or more treatments. Issues of long-term safety and effectiveness. Not effective on light and non-pigmented hair such as blonde, red, or gray/white. Depending on the specific laser, generally not an effective method on dark or tan skin. Safety concerns for the eyes and the need for protective eyewear. Uncomfortable for some people. No guarantee of satisfaction. Inadequate and inconsistent state regulatory controls and guidelines. Check-in. What are the main active ingredients in depilatories? What is another name for threading? What is the biggest benefit of cleaning up after hand-applied sugaring? What is the minimal length of hair that can be removed with sugaring? Which modality of electrolysis utilizes direct current? What is the main benefit of electrolysis? What is a downside to electrolysis? Name a safety concern for laser/IPL. Explain when to use hard and soft wax methods of hair removal. Waxing services are one of the most popular services in salons and spas, and still the most common form of hair removal. There are two types of waxes. Hard wax, where no strip is used for removal. Soft wax, which uses a strip for removal. Both waxes have different qualities that make them a preferred choice for different kinds of hair removal services. Estheticians generally use soft wax in larger areas, such as the back and legs, and hard wax in smaller areas, such as the eyebrows, axillae, and bikini area. Wax formulas are made from rosins, derived from pine tree resin, beeswax, paraffin, honey, and other waxes and substances. They may also include additives such as azulene or chamomile for sensitive skin or tea tree oil for its soothing and antiseptic benefits. Caution: gloves must be worn for all waxing services. Wax product consistencies vary, as do melting points. It is important to keep the wax at the temperature recommended by the manufacturer so that it works effectively and optimally. Leaving the wax unit on overnight or overheating the wax diminishes its effectiveness and may cause injury. Both hard wax and soft wax regrowth is softer and there is no stubbly feeling. Regrowth generally takes 6 to 8 weeks after waxing. Hard wax essentials. Hard waxes are available in blocks, discs, pellets, or beads. Generally, the harder the wax, the more heat is required to melt it. They are based on a resin called rosin that is often combined with beeswax as well as candelilla and carnauba waxes to modify the melting point and provide increased strength. The used wax is discarded after each service. Figure 11:13. Hard waxes come available in blocks, discs, pellets, or beads as featured. Hard waxes are gentle enough for facial area, yet strong enough to be used on hard-to-remove, coarse hair and areas where hair growth converges from multiple directions. Some like to use it on the bikini and underarm areas. Hard wax is thicker than soft wax. Pre-treatment for hard wax. Cleanse and prepare the client's skin with products recommended by the manufacturer of the wax, as they are formulated for optimal results. With cotton and cleanser or makeup remover, remove all traces of makeup on the area to be waxed, as makeup can be an irritant and can prevent the wax from adhering. For larger areas of the body, such as arms, legs, and back, a spray cleanser containing the wax manufacturer's recommended product, or a general antiseptic product such as witch hazel, is faster and more economical. This wax method generally requires a thin application of pre-wax oil to protect the skin. It should absorb and not leave an oily film. Hard wax technique. Hard waxes are applied with an applicator at a 45-degree angle directly to the skin in a thick, wet-appearing layer that hardens as it cools. It is first applied against the hair growth, then back over in the direction of hair growth in a figure 8 pattern, like frosting a cake. This is done to ensure that each strand of hair is completely coated, as hard wax is not as thin as soft wax and does not run under the hair as soft wax does. As the wax hardens, it tightens, grips the hair, and lifts off the skin. The esthetician then grips the wax at one end and pulls it while it still feels tacky. The gripping is helped by creating a tab of slightly thicker wax at the end where the pull originates. Figure 11:14. A hard wax application. Hard wax can be removed in the direction of hair growth, thus, the follicle is not distorted. It can also be removed against or sideways to the direction of hair growth. It is especially effective in areas where hair grows in multiple directions or on thin or fragile skin. Therefore, application and removal depend on the area to be waxed and how coarse the hair is, as well as the individual manufacturer's instructions for their brand of hard wax. Hard wax can be applied to an area a second time during the service. Hard wax, post-treatment care. It is uncomfortable to remove remaining pieces of hard wax by picking them off. They should be removed with a post-treatment oil. Products containing chamomile, tea tree oil, or aloe vera can provide soothing aftercare. Hard wax dose. Follow the manufacturer's recommendations for heating the wax. Regularly stir the wax and refresh with pellets or beads if necessary. Test the wax prior to use on the client. Apply the wax in a figure 8 movement, under and against, then over and with hair growth. Apply the wax with clean borders to avoid leaving wax behind after the removal pull. Apply the wax to the thickness of a nickel with no visible hair beneath it. Form a slightly thicker tab at the end for gripping during removal. Discard used wax. Check for contraindications with the client and obtain a signed release. Hard wax don'ts. Do not overheat the wax or leave the heat on overnight. Do not apply wax to a client without testing the temperature for safety. Do not double dip a spatula. Do not reuse the wax. Do not apply wax inside the ear canal or nostrils. Soft wax essentials. Soft wax is the most common method of hair removal. There are multiple brands with various additives for the face and other body areas and levels of sensitivity, but they are predominantly made of rosins that adhere to the skin. Professional soft waxes have a lower melting point and come in cans, although some come in plastic bottles for single client use with roller heads for application in place of a spatula. Soft wax has the consistency of honey when melted and ready for use. Soft wax, when applied in a timely manner, runs down and around the hair while also adhering to the skin, and must be removed immediately with a piece of muslin or pellin, while still warm. Figure 11-15. A soft wax application. Pre-treatment for soft wax. Cleanse and prepare the client's skin with the manufacturer's recommended products. If there is no makeup to be removed, a product such as witch hazel can be used. If waxing the face, a thin film of tea tree oil can be applied to protect the skin and minimize redness, followed by a dusting of baby powder, to ensure the area is dry and oil-free. Caution. Some regions may prohibit the use of roll-on wax due to concerns with cross-contamination in the wax and proper disinfection of the applicators. Bottles of wax with roller applications must be single-use. They are used on a client, and then the roller must be disinfected prior to its use on a subsequent client. Make certain to check with your state regulatory board and OSHA to be in compliance. Soft wax technique. Soft wax should be tested for correct and safe temperature and consistency before being applied to the client. Using an appropriate size applicator for the area, apply a thin coating of wax in the direction of hair growth, by swiftly gliding the edge of applicator at a 45-degree angle across the area, allowing the wax to slide off the applicator as it moves across. Quickly place the appropriate size muslin or pellin strip over the area. Make sure there is a wax-free portion at the pulling end of the strip to grip it for removal. Rub firmly over the strip 2 to 3 times in the direction of growth. Place one hand firmly on the skin at the pulling end while using the other hand to grab the strip and swiftly pull it, close and parallel to the skin, back against the direction of hair growth. Immediately after the pull, apply gentle pressure to the area. Removing soft wax in the incorrect direction can have serious consequences, as will waxing over an area a second time during the same appointment. Blending. Blending is a technique that utilizes the wax that has built up on the muslin or pellin strip to remove the more obvious hairs, while leaving shorter hairs behind. It produces a gradual demarcation between completely hairless and some hair. Post-treatment care for soft wax. Residual stickiness should be removed with a soothing wax removal lotion. Puffiness, mainly on the upper lip, can be treated with aloe, ice in a bag, or cold stones immediately following the service. Hives can also occur and can be avoided subsequently if the client takes an over-the-counter antihistamine. Speed waxing. The quick application and removal of soft wax is known as speed waxing. Speed is more comfortable for the client. Faster procedures save time, lead to more revenue, and ensure more satisfied clients. To prepare the limbs, it is faster and more pleasant for the client if you work simultaneously by spraying the cleaning solution on both limbs, then wiping in sequence down the limbs with both hands, finishing at the fingers or toes. To prepare the underside of the client's legs, the legs should be bent with the knees up so that your hands can easily reach without inconveniencing the client. Wipe any excess moisture off with 2 paper towels, one in each hand. Soft wax dose. Follow the manufacturer's directions for heating the wax to the correct and optimal temperature. Test the wax prior to applying to the client. Check for contraindications. Obtain a signed release. Wear gloves. Apply the wax in the direction of hair growth. Apply the wax thinly to prevent injury. Remove the wax strip against the direction of hair growth. Soft wax don'ts. Do not provide service without a consultation and obtaining a signed release. Do not apply the wax without testing first for temperature. Do not apply the wax thickly, it will injure the client. Do not double dip the spatula. Do not let the soft wax cool before pulling. It will bruise or lift skin. Don't go over a waxed area a second time in the same service, as it could burn, lift, or otherwise damage the skin. Selecting the right wax for the best service. Knowing the pros and cons of hard and soft wax helps determine the most suitable wax for the client and the area to be treated. Refer to Table 11.1. Table 11.1. Hard wax versus soft wax. Facts about hard wax. Hard wax, when removed in the direction of the hair growth, does not distort follicles. Hard wax does not adhere to the skin and therefore causes less irritation. Hard wax is effective where the hair grows in multiple directions, such as in the axilla region. Hard wax is preferred for the labia during a Brazilian bikini wax. With hard wax, the area can be waxed a second time during the service, provided there is no irritation. Hard wax may be used with caution on individuals who use glycolic or other alpha-hydroxy acid, AHA, skincare. Eyebrows may be waxed with hard wax if topical prescriptions such as Retin-A registered or Differin registered are being used by the client but have not been applied directly to the eye area. Hard waxing is a slow and laborious method and takes considerably longer than soft waxing, especially on large body areas like legs and back. With hard wax, the hair cannot be blended. If hot wax is left to get old in the wax heater and new wax is not added periodically, the old wax heater becomes brittle when used and loses its removal properties. Facts about soft wax. Soft wax is removed against the direction of hair growth and distorts hair growth. Regrowth stands to attention rather than lying flat. Soft wax adheres to the skin and can cause redness and irritation. Where hair grows in multiple directions, soft wax has to be applied in small sections. Soft wax cannot be removed against the hair growth on the labia, making it a poor choice for a Brazilian bikini wax. With soft wax, the area cannot be waxed a second time during the service. Soft wax cannot be used on individuals using glycolic acid or AHAs. Soft wax cannot be used anywhere on the face if prescriptions such as Retin-A registered or Differin registered are being used by the client. Soft wax is a considerably faster method of waxing than hard waxing and the preferred choice for larger body areas. Soft wax already present on the strip is perfect for blending, especially around the shoulder between a waxed back and non-waxed chest. Soft wax does not need to be refreshed to maintain its removal properties. Facial waxing during facials. Eyebrow or upper lip waxing can be performed during a facial, but it should be done after the cleansing, gentle exfoliation, steam, and extractions and before the mask. Waxing should not be performed if any aggressive exfoliation has taken place, or over an area where extractions were performed. The mask should be soothing. If the indicated mask therapy is not going to be soothing, then a soothing lotion and cool damp cotton should be applied to the waxed area and the area should be avoided with the mask. Did you know? New wax formulas continue to appear on the market. Some take hold, while others dwindle into obscurity. One current wax formulation that is gaining popularity is Flex Wax. It coats the hair like a soft wax, being applied in the direction of the hair growth, but is removed against the hair growth without a strip, like hard wax, after being allowed to set for 30 seconds until it becomes tacky. In testing, it has been found to also be effective when applied like hard wax, under and against hair growth and back over in the direction of growth and removed with the growth, thus not unnecessarily distorting hair follicles. Check in. What are 2 benefits to speed waxing? What are 2 downsides of waxing? Provide a thorough client consultation for hair removal services. A successful hair removal service is achieved with a detailed consultation, a prepared room, and following all protocols for cleanliness, pre-care, the service, and post-care. Complete the client consultation forms. A client intake form should be completed by each new client and kept in the client's file folder. Ask the client to complete a questionnaire that discloses all products and medications being used, both topical, applied to the skin, and oral, taken by mouth, along with known skin disorders or allergies. Allergies or sensitivities must be noted and documented. Changes in medications, facial treatments, and skincare can occur between clients' visits. Therefore, clients should read, update, and sign a release form at the start of each appointment. Clients should also be given post-care instructions and precautions at this time and again after each waxing service. Figure 11:16. The Client Wax Intake Form. Figure 11:17. The Wax Release Form. The Intake/Client Assessment Form. Intake or client assessment forms can be long and in-depth for certain procedures requiring a medical history or for new clients who may become regular clients. A longer intake form is not required to be filled out for each and every wax appointment, but regular clients should be asked, prior to each appointment, if there are any changes to their health or skin care regimen. There should always be a place on the intake form or record card for consent to receive the service and acknowledgement that it is the client's responsibility to inform the esthetician of any changes that could affect the outcome of the procedure. The Wax Release Form. In place of the longer intake form or client record, a simpler wax release form should be signed prior to each wax appointment, particularly for any facial waxing service, as clients may have changes to their prescriptions or skin care. This can alert the esthetician and client to anything that might contraindicate the service or negatively affect the outcome. The wax release form should list the contraindications and potential risks to the wax service and have a place for the client's signature. By signing the form, the client assumes the responsibility of informing the esthetician of any changes in health or skin care and an awareness of the risks that go with waxing. For the client and also the esthetician, the wax release form serves as a protection against a formal complaint. Informed consent for minors. Minors, that is, individuals younger than 18, should be accompanied by a parent, guardian, or other caregiver who has written authorization from the parent or guardian. The responsible adult should sign the release giving permission for wax services and be present for those services. Post-wax instructions and precautions. Following waxing, clients should avoid sun exposure in tanning booths, exfoliation, creams with fragrance or other ingredients that may be irritating, and excessive heat, example hot tubs, saunas, for at least 24 to 48 hours and if any redness or irritation is present. Discuss the client's indications and contraindications. Indications are outward signs that the desired service would be successful and beneficial. In relation to waxing, indications include: hair to be waxed should be a minimum of inch long if it is virgin hair, meaning previously untreated hair, or fine regrowth. Hair should be inch long if it is shaven and coarse, which is approximately 10 to 14 days growth post-shaving. If possible, the client should lift ingrown hairs for days to a week prior to the service, leaving the hair in the follicle and allowing the follicle to heal and normalize. Working the area of the body with a loofah or using an exfoliating body scrub prior to waxing is recommended, but not on the day of the service. The client should avoid tanning, sun or booths, for 24 hours before and after the area is depilate. A contraindication is a symptom or condition that makes a service or procedure unadvisable or that it should proceed with utmost caution. See Table 11:2 for waxing contraindications. Table 11:2. Contraindications for waxing procedures. Contraindications for waxing procedures. Leg waxing should not be performed on clients who have varicose veins. Body waxing should not be performed on clients with phlebitis, skin disorders, epilepsy, diabetes, hemophilia, or other contraindicated medical conditions. Facial waxing should not be performed on clients who have any of the contraindications listed in the remainder of this table, until physician's approval is obtained. Recent treatments or product use. Recent chemical exfoliation using glycolic acid, salicylic acid, or other acid-based products. Recent microdermabrasion or injectables, Botox registered or other dermal fillers. Recent cosmetic or reconstructive surgery, laser treatments, or IPL treatments. Recent use of exfoliating topical medication, including adapalene registered, Retin-A registered, Renova registered, Tazorac registered, Differin registered, Azelix registered, vitamin A, or other topical peeling agents. Recent use of hydroquinone for skin lightening. Recent use of topical or oral cortisone medication. Medical conditions or medications. Acne medications such as tetracycline and Accutane, physician guidance required. Recent use of blood-thinning medications, example, Coumadin registered, Lovenox registered, warfarin, heparin. Circulatory disorders, example, phlebitis, thrombosis. Chemotherapy or radiation. Epilepsy, diabetes, hemophilia. Autoimmune disorders, example, HIV, AIDS, lupus. Skin conditions. Acute acne vulgaris. Rosacea or very sensitive skin. Sunburn, inflammation, bruising. History of fever, blisters or cold sores, herpes simplex. Presence of pustules or papules on area to be waxed. Other contraindications. Scar tissue, moles, skin tags, warts. Skin disorders, example, eczema, seborrhea, psoriasis. Thin, fragile skin. Lack of skin sensation. Other considerations. Avoid the inside of the nose, ears, over the eyelids, and over the areola and nipples. Pregnant women in their last trimester should not get a waxing service if they have to lie flat for more than 20 minutes. Check for product allergies to wax ingredients. Contraindicated products and treatments should be stopped 1 month to 6 weeks prior to waxing or according to a physician's recommendations. It can take up to 3 months or longer before the skin is ready to be waxed following the use of harsher products and treatments. These are only guidelines and a client's medical information needs to be carefully reviewed. Consider the needs of the transgender client. Male to female gender reassignment is of professional interest to estheticians, as their professional services in hair removal are often called for. The stages that a patient must go through to complete gender reassignment from male to female are as follows. Emotional and psychological counseling. Patients may be advised to dress as women for increasing amounts of time. At this early stage of transition, they may seek temporary services listed here, so they feel more feminine in women's clothing. They may not elect to do much to the face at this time, other than be clean-shaven, as they may need to return to their male persona for work. Hormone replacement therapy, HRT. Once the decision is made to go ahead with a permanent form of gender reassignment, a careful program of HRT is given to counter the male hormones with female hormones. At this stage of transition, the patient also often undergoes laser treatment and/or electrolysis to the face and other body areas, including the penile shaft. Many patients also request more dramatic and obvious beauty services. Reassignment surgeries. There are 3 main types of surgery that the transgender male to female patient may undergo. 1. Facial feminization surgery, which may include facial plastic surgery and breast augmentation. 2. Genital surgery, and 3. Voice feminization surgery, in which adjustments are made to their vocal cords. Most common services. The most common services for the male to female transgender client will vary depending on what phase of the transition they are in. In the early stages, phase 1 of the preceding list, many will book arm and leg waxing, simple manicures and pedicures, minimal eyebrow trimming, facials, makeup applications and lessons, and fitting for wigs. During phase 2 of the preceding list, patients often undergo electrolysis, laser hair removal, more dramatic facial peels, more dramatic shaping of the eyebrows with either tweezing, waxing, or electrolysis, and more feminine hair and nail services. In phase 3 of the preceding list, there is a continuation of the services of phase 2. List items needed in a wax treatment room. The waxing room and equipment should be immaculately clean, warm, and comfortable. Optimally, there should be a sink. The music can be livelier than the music that is played during more relaxing treatments like massages and facials. Wax equipment. Furniture should be ergonomically designed so that both the esthetician and client are comfortable. The waxing table should be adjustable to different heights and able to adapt from flat to a semi-reclining chair position for face waxing. If this is not possible, it should be the best height for the esthetician to provide lengthy services without straining. A stool may be necessary to help the client onto and off of the table. A multi-tiered rolling cart for holding waxing pots and supplies can be moved near the client, keeping tools and supplies close at hand. Figure 11-18. A well-stocked wax cart. Set up an assortment of covered containers for applicators, cotton, and gauze squares. Prepare a covered holding tray and disinfection solution daily. A covered container stores clean and disinfected items like tweezers and scissors. A covered waste container is necessary for the proper disposal of all used supplies. An assortment of towels and linens in a cabinet allows for easy access. Wax treatment essentials. Wax heaters, one containing hard wax and the other soft wax. Tweezers, slanted and pointed, made of surgical steel able to withstand disinfection. Scissors for trimming eyebrows, must be able to withstand disinfection. Scissors for cutting wax strips. Metal spatulas that can be disinfected, a sufficient number to ensure double dipping is not necessary. Single-use items. Bikini bottoms. Cotton rounds. Facial tissues. Gauze. Headbands, hair clips, or bobby pins. Paper drapes. Paper towels. Single-use wooden wax applicators, large, tongue depressor, medium, popsicle sticks, or small. Treatment table paper rolls. Gloves, non-latex. Wax strips of pelin, fiber, or muslin, cotton, which comes in rolls 3 inches wide or as pre-cut packets for the body, 3 × 9, and eyebrow and upper lip, 1 × 3. Did you know? You can cut 9 of 1 × 3 brow or lip strips from a 9 × 3 body strip. Consumables. Pre-care, hand soap, wax manufacturers' recommended products, and/or cleansers/makeup remover, antiseptic lotions such as witch hazel, tea tree oil, and baby powder, numbing/topical anesthetic products, and desensitizing spray. Post-care, petroleum jelly for removing wax from eyelashes or other hair. Wax-removing lotion for skin, calming products such as aloe vera gel, salicylic lotion, arnica, and azulene. Baking soda for soothing compress solution. Eyebrow pencils in assorted colors, sharpener, eyebrow brushes. Caution. Desensitizing spray products must never be sprayed on the face, rather, spray onto a cotton round and apply to the face. Hygiene and infection control. Following protocols and maintaining high standards of hygiene, cleanliness, and infection control reduce the risk of cross-contamination from esthetician to client, from client to esthetician, from client to client, and from esthetician to esthetician. Keep applicators, strips, gauze, and cotton supplies in covered containers when not in use. Clean tongs can be used to retrieve items after starting a service. Gloves must be worn for all services and for cleaning and processing equipment. Tweezers and any other multi-use items should be thoroughly cleansed, dried, and placed into a wet disinfectant following the manufacturer's instructions. After cleaning, place the used instruments into an EPA-registered disinfectant solution that is designated to kill all microbes, including Staphylococcus, tuberculosis, Pseudomonas, a pathogen, fungus, and the HIV virus. Stainless steel instruments can also be processed and sterilized in an autoclave. A metal spatula is exclusively used on a single client, any remaining wax is discarded, and the container is disinfected and refilled or replaced. Multiple metal spatulas can be removed without double dipping, and then processed after the service. Double dipping is never acceptable. Table and chair protection. Any part of the table that will come in contact with client's skin or scalp must have protection, either paper that is disposed of immediately after the service or linens that are placed in a closed laundry hamper immediately after use and replaced with each client. Place a clean sheet or sheet of paper on the entire waxing table for each new client for body waxing. If the client is receiving face waxing, place protective paper sufficient for under the head, neck, and shoulders. Draping and disposable protection. Clients have differing views on modesty. The standard should be to keep areas covered that are not being waxed, uncovered immediately prior to waxing, then recovered after waxing. Disposable paper drapes serve this purpose well. Until the esthetician can perform waxing services neatly and cleanly, towels and linens should be avoided in favor of disposable drapes. Wax is damaging to linens and towels, as it does not easily wash away. Disposable bikini bottoms for bikini waxing not only provide modesty but also protect sensitive areas. Disposable headbands protect unruly or flyaway hair from getting in the way of face wax. Figure 11-19. Disposable drapes are ideal for protecting linens from wax strips. Learn hand washing and infection control measures. Estheticians' hands must be thoroughly washed before and after contact with the client. Do not put contaminated hands or gloves into clean containers. Use clean gloves or disinfected tongs to open and reach into a drawer if more supplies are needed. Hand washing in front of the client inspires confidence. Understanding glove use. Always wear gloves. Hair removal causes trauma to the follicle. When the hair is forcefully removed from the follicle, blood spots may occur, and blood and fluids may rise to the surface of the skin. This is normal. This is the blood that has been nourishing the hair papilla. Use vinyl or nitrile gloves, not latex. Latex breaks down easily via a process known as wicking, which occurs when the gloves come in contact with wax and certain products that act as surfactants, creating minute holes that allow pathogens to pass through. Change your gloves if they become excessively sticky during a waxing service. Do not double dip. Do not double dip the spatula or applicator unless you are disposing of the entire pot of wax after treating that individual client. Otherwise, use a new spatula each time to dip into the pot of wax. Disposal of contaminated waste items. All blood-stained, bodily fluid, contaminated cotton, gauze, and other materials should be immediately discarded by double bagging or placed in a biohazard waste container and disposed of properly. Mastering cleanup. Clients should be booked so as to allow enough time to turn the room over in between, making it clean, tidy, and presentable. The following steps are necessary in this process. Throw away disposable drapes and other disposable items. Clean and disinfect the treatment table and work area. Change table linens. Change wax heater collars if overly soiled with wax strips. Place tools in a disinfectant holding tray. Use a wax removal solution to wipe away wax from all surfaces, including the floor. Retrieve new clean items and have them at the ready for the next service. Retrieve paperwork, including the client's intake form and wax release form. Check in. List 3 important infection control methods. What is the best way to remove wax from eyelashes? Demonstrate waxing head to toe with soft and hard waxes. While waxing with either soft or hard wax can be accomplished on virtually any part of the face or body, with the exception of a man's beard, nostrils, ears, and eyelids, there are preferred wax choices for differing areas and situations. Both will be addressed, with the emphasis on the preferred method. General waxing dose and don'ts. General waxing dose. Complete a client consultation card and have the client read and sign a release form. Check for allergies, particularly beeswax, performing a patch test in a non-conspicuous area if necessary. Wear single-use gloves to prevent contact with any possible bloodborne pathogens. Make sure hair is at least inch 0.6 centimeters to inch 1.25 centimeters long for waxing. Trim hair before waxing if it is longer than inch 2 centimeters. Perform a temperature safety test on the inside of your wrist before applying wax to the client. Avoid creating messy threads of wax by scraping the underside of the spatula or applicator after dipping. Avoid wax threads or drops falling on the client's eyes or lashes. The client's eyes should be closed for face waxing. Protect scalp hair with a headband for face waxing. Protect clothes to avoid wax drips near the area you are waxing. Select the best choice of wax with the appropriate pre- and post-treatment. Always apply gentle pressure, fingers for small areas or the entire hand for larger body areas, immediately after removal. Redness and swelling sometimes occur with sensitive skin. Apply aloe gel or cortisone cream or a compress of gauze soaked in baking soda to calm and soothe the skin after waxing. Always provide post-treatment instructions. General waxing don'ts. Do not apply wax without first checking the temperature. Do not reapply soft wax to an area already waxed in the same session. Do not touch the client without washing your hands. Do not double dip. Do not remove vellus hair. Doing so may cause the hair to lose its softness and uniformity. Do not apply wax over warts, moles, abrasions, or irritated or inflamed skin. Never wax over curves or two different planes in one application. Do not wax male mustache or beard hair or sideburns as it is terminal, coarse, and grows deep into the skin. Did you know? To safely cover an area such as a blemish or abrasion that cannot be waxed and that is close to where you are removing hair, apply an occlusive balm such as petroleum jelly over the area so wax will not adhere to it. Face waxing on women and men. The following section covers information on waxing the eyebrows, lips, chin, and sides of the face. Caution. Avoid waxing the eyebrows if there are signs of irritation or infection present like conjunctivitis or a sty. Waxing the eyebrows. Eyebrows enhance and provide expression to the face. They provide a natural frame for the eyes. Incorrectly shaped eyebrows can give the entire face an odd appearance, and correctly shaped eyebrows can enhance natural beauty and attractiveness. Correctly shaping eyebrows is an art combined with following a few simple rules. The start of the brow is the corner nearest the nose, with an ascent to the point of the arch, followed by the descent to the end of the brow on the outer edge. The start, arch, and end point are all determined with the placement of an applicator using the guide illustrated. Some clients have wider nostrils than others, which could affect the start line. An alternative guideline is to rest the applicator alongside the nose, just above the nostril, for a more accurate start point. Figure 11, 20A. Brow Shaping Guidelines. Figure 11, 20B. Alternate Brow Shaping Guidelines. Did you know? If any wax falls onto the client's lashes, request that the client keep the eyes gently closed. Slide some damp cotton under the client's lashes, then using cotton or a cotton tip applicator and petroleum jelly, stroke down the lashes until the wax slides off. An initial eyebrow shaping appointment will require more time than follow-up maintenance visits. Discuss in detail with the client what your professional knowledge and experience tell you should be achieved with the shape, while listening and being sensitive to the client's opinion. Giving the client a hand mirror and using the handle of the eyebrow brush, show the client where the arch is, and if it is misplaced, where it should be. Some eyebrows require minimal shaping, whereas others may need a complete reshaping that requires not only removal of unwanted eyebrow hair but applying eyebrow pencil to fill in where hair should be allowed to grow back. Clients can be instructed to apply the eyebrow pencil while waiting for incorrectly removed hairs to grow back in. Brush the eyebrow and determine exactly what you want to accomplish and convey that to the client, making sure they are in complete agreement before you proceed and apply any wax. Waxing above the eyebrows, especially on the descent, can diminish the hair growth that may be wanted in years to come as eyebrows thin and eyes droop. After any eyebrow wax, hairs that were too short, and so not removed, may be tweezed. This brings those hairs into the same forced telogen cycle as the waxed hairs. After completing the eyebrow wax, apply aftercare with a soothing antiseptic lotion to the area and massage both eyebrows simultaneously, finishing with gentle pressure at the temple. Performing a men's eyebrow wax with soft wax. Male clients generally just want a unibrow and any heaviness under the brow removed, but without emphasizing an arch. The start point should be slightly further in towards the center from the corner of the eye, unlike the start point for women. To avoid waxing a totally clean line that can look strange on a male client, be conservative with the amount of hair to be removed, allowing for intermittent tweezing along the brow line for a more natural look. Perform. Procedure 11 to 2 eyebrow wax with hard wax. Perform. Procedure 11 to 3 eyebrow wax with soft wax. Waxing the lip. With any face waxing but especially lip waxing, ask a new client if it is for a special occasion and let them know that there could be redness and puffiness and sometimes pimples following the waxing. Hard wax is a good choice for this area, or a cream wax or a soft wax designed for more sensitive skin, reducing the occurrence of redness. The upper lip is divided, under the nose, into 2 equal sections for hair removal. The hair grows down and outward at a slight angle, following the lip line. Under the nose it grows straight down. Under the nose it is impossible to pull the hair against its growth to remove those hairs. The hair, which is usually fine in texture, is easily removed when pulling across the lip line sideways to the growth with the rest of the hair on that half of the upper lip. If the hair is coarse, hard wax may be the better choice. Figure 11:21. The hair on the upper lip grows down and outward at a slight angle, following the lip line. Clients may choose to have superfluous hair removed from the lower lip. Because the hair of the lower lip grows downward away from the lip, soft wax can be used effectively in this area, or hard wax is acceptable if that's what is being used on the upper lip. Perform. Procedure 11 to 4 lip wax with hard wax. Perform. Procedure 11 to 5 lip wax with soft wax. There are often nuisance hairs that stand up and bother clients along the immediate lip line, the vermilion border, and the outside corner of the lip line. Wax as close to the border as possible without getting wax on the fragile tissue of the lip, as it can be easily lifted and torn. Any wax that gets onto the lips should be removed with either petroleum jelly or a wax-removing lotion. Finish by applying the aftercare lotion, massaging both sides simultaneously with fingertips, with gentle pressure on the outer edges of the lip. Offer the client some ice in a baggie if the area remains sensitive or feels puffy. Waxing the chin. A chin wax is often considered to include not only the chin but also the area just under the jaw. Waxing should not be considered the primary choice of hair removal for the chin if the client has never removed the hair with wax before, and if there are just a few sporadic hairs. Multiple waxings with soft wax against the growth cause the regrowth on the chin to grow back in an irregular fashion, standing up and looking wispy. Along with removing unwanted hair, waxing also removes non-bothersome vellus hair, leading to even more irregular regrowth. The chin has no specific boundaries. The more it is waxed, the more it will need to be waxed, spreading the problem along the jaw, up the sides of the face, and down the throat. As the facial hair is stripped away in one area, the hair adjacent to it appears more obvious and apparent. Before long the client has to deal with excessive irregular hair growth that has to grow in before it can next be waxed, resulting in ingrown hairs, folliculitis, and the risk of injury to the skin as it matures. The client will not be able to utilize many of the anti-acne or anti-aging treatments available. If there is an abundance of superfluous hair, laser or IPL may be preferred. If there are only a few terminal hairs surrounded by vellus hair, electrolysis may be the better choice. If that is not an option, then using hard wax and removing the hair in the direction it grows is preferred. Waxing should not be performed on terminal, beard-type, deep, coarse hair on the face. Perform. Procedure 11 to 6 chin wax with hard wax. Waxing the chin is performed by standing at the head of the table rather than facing the client, allowing for an easier, less restricted, and smoother removal process. The section under the jaw and the throat are waxed first. Ask the client to tilt their head back as far as possible to help stretch the skin. Separating the throat area from the chin avoids going over any curves. To do so will cause bruising. After the throat and under the jawline are waxed, continue to the chin. The chin should be waxed in small sections. Waxing the sides of the face. Waxing the sides of the face can create problems for your client in the future. Figure 11.22. If they have not had the sides of their face waxed before, then educate and inform them of the consequences down the road. Fine non-pigmented vellus hair is normal and acceptable. However, bright lights and high magnification mirrors often make hair growth appear more superfluous than it really is. Have the client look in a regular handheld mirror held at just short of arm's length away and in normal lighting. If the hair is not visible, it should not be considered a problem, and it may not warrant the disturbance of removal and problems for the client in the future, causing them to regret choosing to wax. Figure 11.22. Isolation of hair on side of the face. Multiple wax treatments with soft wax cause distorted hair follicles and irregular hair growth. Vellus hair that had shallow follicles closer to the epidermis may gradually grow deeper into the dermis, which has a rich blood supply. When the client experiences hormonal changes, the hairs transition to become terminal in their growth pattern. As the client's skin matures, it becomes more fragile, and wax treatments could cause an adverse reaction. The client is left in a quandary, needing to choose other methods such as laser, or if the hair is strong but gray, electrolysis. Caution: do not wax the axilla if the client has had a mastectomy or has mastitis. If the area is to be waxed, hard wax removed in the direction of growth is the better option, thus not distorting the affected follicles. Sugaring is also an option if the hair is not too strong. Hard wax will also grip the stronger hairs of the sideburn without much skin irritation. Waxing the underarm, axilla. Axilla is the correct professional and anatomical term, although underarm is an appropriate term to use with clients. The axilla is the region between the arm and the thoracic wall. There is often asymmetry to the hair growth of the axilla. One side may have more directions of hair growth than the other. The different directions of growth converge in the center, and for this reason, hard wax is a preferred method of hair removal. The hair may be coarse, especially if it has been shaved, which also makes hard wax an optimal choice. The sudoriferous, sudoriferous, or sweat glands soften the skin, so if you do not choose hard wax, then consider a cream or honey wax for sensitive skin. Clearly ascertain the directions of growth and which section is going to be waxed first. The initial section to be waxed should be toward the outside edge, and removal should proceed in sections to the center. Figure 11.23. Determine the directions of hair growth before applying wax. After completing the removal on one side, apply a soothing lotion to the area to prevent the skin from sticking while working on the second side. If the underarm is particularly tender, a cool cotton compress of cold water and baking soda can be applied to the area while the other side is being waxed. Waxing the arm and hand. Soft wax is the fastest, most effective way to remove hair on the arms. However, removing hair against the growth will cause the hair to grow back in an unruly fashion, sticking up. Hard wax or sugaring and removing with the growth will prevent this, although both of those methods are much slower than using soft wax. If the hair growth is strong or already unruly, then soft wax is the better choice. If the hair is fine and virginal, meaning it has not been removed before, it may be worth taking the time to remove the hair with hard wax or sugar paste, removing it with the growth and thus not distorting the hair follicles. This is especially important if the hair removal is a one-time service for a special occasion. Perform. Procedure 11-8 Axilla waxing with soft wax. Perform. Procedure 11-9 Arm and hand waxing with hard wax. Perform. Procedure 11-10 Arm and hand waxing with soft wax. Waxing the upper arm. Most often the upper arm has just a few hairs right above the elbow. These can often be removed with blending, using the wax that is already on the strip. If the hair of the upper arm is obvious, it will require complete removal. Waxing the upper body on women and men. While it is not common for women to receive chest or back waxing, there are some women who request these services. Usually it is in small patches such as the diamond shape of hair at the base of the spine or hair growing and converging in the cleavage between the breasts. Conversely, many men, whether due to personal preferences or athletic performance, request waxing services so that they can be as free of hair as possible in certain body areas. Therefore, the following descriptions are relevant for both male and female clients. Waxing body hair may involve trimming the hair to inch. If using an electric trimmer, cover the wax pot or trim the hair well away from the wax to prevent flyaway hair from contaminating it. Waxing the chest. Although the female areola should not be waxed, hairs surrounding the areola can be waxed away. They grow in a circular direction, surrounding the areola from the outside toward the cleavage. Occasionally random hairs deviate from this direction of growth, especially if they have been tweezed. Chest hair generally grows upward in the décolleté, and across the chest and over the breast from the outside toward the center. Then it gradually transitions to growing downward in the center. Figure 11.24. Diagram of chest showing direction of hair growth. Before waxing a man's chest, with shirt removed, discuss what areas he would like waxed. Men sometimes book this service wanting abdominal hair or hair in front of the shoulders removed, right up to but not including the chest area. A clear understanding is important before beginning. Waxing the back. When men book a back wax, they generally want all the hair removed from just below the waistband upward. If the client is wearing a business suit and will be returning to work, suggest that he remove his pants along with the upper clothing. Provide a hanger to hang them up and a towel or drape to place around his waist. Leave the room while he gets ready. If the client does not need to remove his pants, have him at least remove the belt from his pants for comfort and undo the top button to facilitate placing paper towels along the top edge of his pants. Unless you have a long reach, stand on the same side that the wax is going to be applied first, changing sides after that half is completed. The hair grows from the outside toward the center. If standing on one side for the entire service, complete the side furthest away first. This prevents back strain from fatigue. Figure 11.25. Diagram of back showing direction of hair growth. Waxing the lower body on women and men. Waxing of the lower body includes the bikini area, abdomen, and upper and lower legs. Perform. Procedure 11 to 13 men's back waxing with hard wax. Perform. Procedure 11 to 14 men's back waxing with soft wax. Bikini waxing. Bikini waxing can be categorized in three ways: American, or standard, French, and Brazilian. The waxing method used depends on the client's preference and the extent of hair to be removed. While soft wax is appropriate for the outer regions, areas where there are different hair growth directions, coarse hair, and delicate skin, hard wax is preferred. Blood spots are normal when waxing the bikini area, so inform the client that this is both normal and acceptable. Figure 11.26. Different bikini wax styles. Styles for bikini waxing. The standard American bikini wax is the removal of all hair that protrudes from a standard bikini bottom. The French bikini wax, named for hair protruding from French thong underwear, leaves hair on the front pubis area, everything else is removed. The shape of the hair left and amount of hair to be removed should be clearly ascertained from the client prior to starting the waxing procedure. With Brazilian waxing, all of the hair in the bikini area is removed, including on the pubis, genital area, and perineum. Importance of communication prior to bikini waxing services, for the extent of the wax. Good communication with the client is paramount to be sure that both parties understand what hair is to be removed and what should remain. A client may want hair removed from the labia and perineum and request a Brazilian wax, but in fact she wants to keep some hair on the pubis. Perform. Procedure 11 to 15 American bikini wax with hard wax. Perform. Procedure 11 to 16 American bikini wax with soft wax. Waxing the leg. Waxing half a leg can vary considerably between an upper leg and a lower leg. The hair of the upper leg may be less dense in its growth when compared to the lower leg, but a larger surface area still has to be covered, taking more time and using more wax than the lower leg. Figures 11, 27 and 11 to 28. Figure 11, 27. Diagram of hair growth direction on front of the leg. Figure 11, 28. Diagram of hair growth directions on the back of the leg. Perform. Procedure 11 to 17 leg waxing with soft wax. Procedures 11 to 1 to 11 to 17. Equipment, materials, and implements. Gather the following supplies and products as required for hair removal procedures. Equipment and supplies. Assortment of covered containers for applicators, cotton, gauze squares. Assortment of towels and linens. Client charts. Clothes hangers. Covered holding tray for disinfectant solution. Covered steel container for processed items like tweezers and scissors, optional. Covered trash container. Disinfectant. Eyebrow pencils in assorted colors. Hand soap. Hand sanitizer or antibacterial soap. Multi-tiered rolling cart. Pencil sharpener. Usable spatulas that can be disinfected and enough of them to not double dip. Scissors that can be disinfected for trimming eyebrows. Scissors for cutting wax strips. Stool. Tweezers, slanted and pointed, made of surgical steel able to withstand disinfection. Waxing table. Wax heaters, one containing hard wax and the other soft wax. Single-use items. Bikini bottoms. Cotton rounds or squares. Cotton swabs. Eyebrow brushes. Gauze. Headbands. Hair clips, disposable metal or washable plastic. Paper drapes. Paper towels. Trash bag. Tissues, unscented. Treatment table paper rolls. Vinyl or nitrile gloves. Wax removal strips of pelin, fiber, or muslin, cotton, which come in rolls 3 inches wide or pre-cut packets, for body 3 x 9, 7.5 centimeters x 22.86 centimeters, and eyebrow and upper lip size 1 x 3. Wooden wax applicators, large, tongue depressor, medium, popsicle sticks, or small. Products. Antiseptic lotions, witch hazel, tea tree oil, baby powder, numbing/topical anesthetic products. Baking soda for compress solution. Cleansers/makeup remover. Desensitizing spray products, topical numbing solution. Petroleum jelly for removing wax from eyelashes or hair. Wax manufacturer's recommended products. Wax removing lotion for skin, calming products like aloe vera gel, salicylic lotion, arnica, azulene. Procedure 11 to 1. Perform eyebrow tweezing. Time for this service, 10 minutes, 15 minutes for complete reshaping. 1. Discuss with the client the desired and appropriate shape. 2. The head of the table should have protective paper for under the head, neck, and shoulders. The client should be in a semi-reclined position on the table, with the scalp hair protected and off the face. Wash and dry your hands, then put on gloves. 3. Cleanse and prepare the skin, using a makeup remover to remove makeup if present, otherwise using a mild antiseptic. 4. With a disposable brush, measure the start point, end point, and correct arch location. 5. Brush the brows upward and isolate longer hairs that require trimming. Trim longer hairs with small round-tipped scissors to be uniform with the natural brow line. Brush along the top of the brow line and decide which hairs need to be removed. 6. Standing or sitting behind the client and using the middle finger and forefinger, apply gentle friction to the brow area to warm the area, open the pores, and minimize discomfort during tweezing. 7. Using the forefinger and middle finger of the hand not holding the tweezers, hold the skin of the brow taut. Remove unwanted hairs underneath the brow closer to the nose, working to the outer edge using a quick smooth motion, grasping the hair as close to the skin as possible without pinching it, and tweezing the hair in its direction of growth rather than pulling straight up. 8. Brush the hair downward and remove hairs above the brow as necessary for the predetermined shape. After completing the brow, repeat the procedure on the second brow. 9. Proceed to the glabella, the area between the brows, where some hairs grow upward and some downward. 10. Wipe the treated area with a soothing, non-irritating antiseptic lotion to close the follicles and reduce the risk of infection. 11. Finish by brushing the eyebrows in line. Procedure 11-2. Perform an eyebrow wax with hard wax. Time for this service, 20 minutes, 30 minutes for complete reshaping. 1. The head of the table should have protective paper for under the head, neck, and shoulders. The client should be in a semi-reclined position on the table, with hair and clothing protected. Wash and dry your hands, then put on gloves. 2. The area to be waxed should be cleansed of makeup, facial oils, and pollutants. 3. Pre-treatment should be in accordance with the wax manufacturer's recommendations, which may mean, with hard wax, its complementary pre-wax oil. 4. Having agreed on the desired shape during the consultation, brush the eyebrows using a disposable brush. Measure the eyebrows for the start point, end point, and point of arch. 5. Dip the small applicator into the wax and scrape the underside to avoid threads. 6. Standing behind the client, with a small spatula, apply the wax to the entire area under the brow, first against the direction of hair growth, and back over the same area in the direction of growth. 2 or 3 applications may be necessary so that neither the hair nor the skin is visible through the wax. The strip of wax should have a clean, even edge all the way around for a clean removal, with a thicker tab at the outer edge where it will be lifted for the removal. 7. Within 30 seconds, when the wax looks opaque and maintains a fingerprint, it is ready to lift off. Flick up the grasping edge of the wax on the outer edge of the eyebrow and with a thumb, hold the skin taut at the outer edge. Grasp the wax and pull quickly against the direction of growth as close to the skin as possible. 8. Immediately apply pressure to the area. Once you have become proficient in the use of hard wax, the wax can be applied to the second eyebrow while you are waiting for the wax on the first eyebrow to set. 9. Repeat on the other eyebrow. 10. When applying wax to the glabella, the area between the eyebrows, the procedure is the same. Apply the wax first against the growth, then back on top in the direction of growth and remove against the growth. Although there may be growth upward at the top of the glabella and downward at the top of the nose, hard wax can remove both directions in a single application and removal. Note, if needed, tweeze above each brow to remove any stray hairs. If needed, trim any extra long stray hairs using rounded brow scissors. 11. Finish with aftercare by massaging both eyebrows simultaneously with a soothing lotion and brushing the eyebrows. Procedure 11-3. Perform an eyebrow wax with soft wax. Time for this service, 15 minutes, 30 minutes for an eyebrow reshaping. 1. The head of the table should have protective paper for under the head, neck, and shoulders. The client should be in a semi-reclined position on the table, with hair and clothing protected. Wash and dry your hands, then put on gloves. 2. The area to be waxed should be cleansed of makeup, facial oils, and pollutants. 3. Pre-treat the area to be waxed with the wax manufacturer's recommended products for soft wax or a thin film of tea tree oil followed by an application of baby powder. 4. Having agreed on the desired shape during the consultation, brush the eyebrows using a disposable brush. Measure the eyebrows for the start point, end point, and point of arch. 5. Dip the small applicator into the wax and scrape the underside to avoid threads. 6. Standing behind the client, glide the applicator at a 45-degree angle along the underside from the nose point to the outer edge, following the desired line for hair to be removed. For extensive reshaping of considerable hair, a tiny amount of wax on the applicator can be used to separate and pull hairs down and away from the brow line. This can be done facing the client, although the actual waxing is better achieved by standing behind the client. 6. 7. Then place the 1x3 strip over the wax, leaving a free edge at the end point to grasp. Give 2 or 3 quick strokes over the strip, also in the direction of hair growth. 7. 8. Place the forefinger and middle finger at the end point, holding the skin taut, and pull the strip quickly back against the hair growth, as close to the skin as possible. 9. Quickly apply gentle pressure with the fingers that held the skin taut. 10. Repeat on the other eyebrow, and then the glabella. Following the rules for soft wax application and removal, the hairs higher up, growing upward, need to be treated separately from those at the top of the nose that grow downward. Note, if needed, tweeze above each brow to remove any stray hairs and trim any extra long stray hairs using rounded brow scissors. 11. Finish with aftercare by massaging both eyebrows simultaneously with a soothing lotion and brushing the eyebrows. Procedure 11-4. Perform a lip wax with hard wax. Time for this service, 15 minutes. 1. Complete draping and pre-treatment preparations as outlined in Procedure 11-2. 2. The area to be waxed should be cleansed of makeup, facial oils, and pollutants. 3. Pre-treatment should be in accordance with the wax manufacturer's recommendations, which may mean, with hard wax, its complementary pre-wax oil. 4. Standing behind the client and using a medium-sized applicator, apply the wax to half of the upper lip, gliding up under the hair, against the growth, from the outer edge to the halfway point, under the septum of the nose, then back down in a figure-8 motion. The hair may be removed either with the hair growth, if you don't want to distort the hair follicles, or against the hair growth. A thicker tab of wax should be formed at the end where the pull will originate. 5. If also waxing the lower lip, for expediency, wax can be applied to half of the lower lip while the first application is setting. 6. When the wax has lost its stickiness and wet shine, grasp the tab and remove the wax close and parallel to the skin. Then apply immediate pressure. 7. Repeat on the opposite side of the upper lip, and lower if called for. 8. Finish by using both hands to massage with a soothing aftercare lotion. Procedure 11-5. Perform a lip wax with soft wax. Time for this service, 10 minutes. 1. Complete draping and pre-treatment preparations as outlined in Procedure 11-3. The area to be waxed should be cleansed of makeup, facial oils, and pollutants. 2. Pre-treatment should be in accordance with the wax manufacturer's recommendations. 3. Standing behind the client and using a medium-sized applicator, start under the septum of the nose and apply a thin layer of wax in a downward-outward direction. It is important to make sure that the area under the nostril is covered and that no hairs are missed on the edge of the nostril as well as the hair along the edge of the vermilion border, all while avoiding the lip. 4. Immediately after the wax is applied, place the 1x3 strip over it, leaving enough of a free edge on the outside to grasp. Give the strip 2 firm rubs in the direction of growth. 5. With your fingers holding the same outer edge of the lip taut and stable, grasp the strip and pull it quickly across the lip area in the direction opposite of growth, as close to the skin as possible, following through with a quick sweeping movement. 6. Quickly apply pressure to the area with the hand that held the skin taut, to ease the smarting sensation common with this type of waxing in this area. 7. Proceed to the other side of the lip. 8. Finish with an application of soothing lotion. Procedure 11-6. Perform a chin wax with hard wax. Time for this service, 15 minutes. 1. Complete draping and pre-treatment preparations as outlined in Procedure 11-2. 2. Decide how many sections of wax have to be applied to remove the hair under the jaw and down the throat based on sections of approximately no more than 2 times 3 and divide the area accordingly. Hair on the throat grows up toward the chin and from the center outward along the jawline. On the chin, hair grows downward. 3. Standing behind the client, by the top of their head, apply the wax with a medium spatula to the first section. For expediency, wax can then be applied to another section as long as it is not immediately adjacent to the first application. 4. Holding the skin taut, remove one or more sections in the direction of the hair growth and apply pressure immediately after the pull. 5. Apply the wax in small sections below the curve of the jawline. 6. Remove the wax. Due to the contours of the chin, this area should be waxed in small sections. 7. If there is hair along the jawbone, it can be removed in a sideways fashion, similar to a lip wax, preventing the chance of follicle distortion. 8. Finish with aftercare as previously instructed. Procedure 11-7. Perform waxing of the axilla with hard wax. Time for this service, approximately 20 minutes. 1. Complete the draping and pre-treatment preparations, having the client lie flat on the table. If the axilla is deep, place a rolled-up towel bolster under the back directly under the axilla to be waxed. 2. If the hair is long so that it curls over, it should be buzzed or trimmed to inch in length. This will make the service more comfortable and easier to evaluate the different directions of hair growth. 3. Make sure both axilla are thoroughly cleansed of perspiration and deodorant and are dry. 4. Have the client raise the arm above the shoulder, placing the hand behind the head. They should then reach across the body with the other hand and move the breast tissue down and away. 5. Apply the wax against the growth, getting underneath all the hairs growing in different directions first before going back over the top, forming a thicker tab at the end where the pull will originate. 6. If 3 different applications are necessary, a second application can be done while the first is hardening, as long as it is not directly adjacent to the previous wax application and enough space is left in between for the third application. 7. Have the client turn their face away from the axilla to avoid any chance of being hit during the swift removal of the wax. 8. Apply immediate pressure to the area after each removal pull to ease any discomfort. 9. Apply aftercare of soothing lotion to the completed side before moving to the next side. 10. Complete the opposite side and finish with aftercare. Reassure the client that any blood spots are due to the fact that the hair was removed at the papilla. This is a sign of a successful epilation, and they will soon reabsorb into the skin. Ask the client to refrain from using deodorant on the area for at least 24 to 48 hours and until all signs of redness and irritation pass. Procedure 11-8. Perform axilla waxing with soft wax. Time for this service, approximately 15 minutes. 1. Complete preparation, draping and positioning of client and bolstering. To do this, have the client lie flat on the table. If the axilla is deep, place a rolled-up towel bolster under the back directly under the axilla to be waxed. Have the client raise the arm above the shoulder, placing the hand behind the head. 2. If the hair is long so that it curls over, it should be buzzed or trimmed to 12 inch in length. This will make it more comfortable and easier to evaluate the different directions of hair growth. 3. Clean the axilla on both sides thoroughly, removing any trace of perspiration and deodorant and pat dry. 4. Ask the client to reach across their body and move the breast tissue down and away. 5. With the edge of a large applicator, apply wax at a 45-degree angle in the direction of hair growth, where possible. If there are different directions within the same cluster, there could be breakage and some hairs left behind. As the same patch cannot be waxed a second time during that service, the remaining hair needs to be tweezed. 6. Using a 3x9 wax removal strip, place the strip of wax and rub 2 times in the direction of growth. Instruct the client to turn their head away to avoid being hit and pull against the hair growth and close to the skin. 7. Each application should proceed by clearing the outer edges, working toward the center until the hair has been removed. 8. Apply aftercare of soothing lotion to the completed side before moving to the next side. 9. Evaluate the directions of growth on the second axilla, as they may well be different than the first. This is more pertinent to soft waxing than hard waxing. 10. Complete the wax application and removal on the opposite side and finish with aftercare as instructed in Procedure 11-8, Step 8. As the same patch cannot be waxed a second time during that service, the remaining hair needs to be tweezed. Procedure 11-9. Perform arm and hand waxing with hard wax. Time for this service: lower arm wax should take approximately 20 minutes, whole arm including hands, 30 to 40 minutes. 1. Have the client sit on the side of the table and remove clothing from arms, exposing the area to be waxed. Complete draping by offering a disposable plastic apron or placing a drape across the client's lap and apply the pre-treatment for hard wax. 2. The first arm to be waxed is outstretched with the palm facing up. Start by waxing the inside lower half of the arm where there is less hair downward toward the wrist, following the application rules for hard wax. 3. The removal pull can be in the direction of growth if the goal is to not distort the hair follicles. 4. The next section to wax should be just above the previous section. 5. After completing the inner arm, have the client turn their still outstretched arm, so the palm faces down. Then hold the arm firmly in place and, starting at the wrist, apply the wax across the top of the arm from the inside, thumb side, to the outside, little finger side, leaving the width of a strip between each application all the way up the forearm to the elbow. 6. After removing the wax, go back and wax those in-between sections. 7. Next, have the client hold their arm straight up, bent at the elbow, to wax the side that follows down from the little finger. This can be done in 2 sections, starting near the elbow, working up toward the wrist. The hair grows down toward the elbow. Remove the wax. 8. For the upper arm, ask the client to relax the arm and allow the forearm to rest on the lap. Apply the wax in alternating sections, starting toward the elbow and working up toward the shoulder. 9. After removing those sections of hard wax, apply the wax to the remaining in-between sections. Remove the wax. If waxing only the arm, apply aftercare. 10. To continue to the hand wax, ask the client to form a fist by tucking the fingers under, as this tightens the skin. 11. Apply the wax down toward the fingers, angling out slightly toward the little finger. The entire top of the hand can be done at once. 12. To remove the wax, since the client's hand is floating without solid support, it is important to have a good grip on the hand for the removal pull. 13. If the fingers need waxing, as the hair grows in a horseshoe shape, the hard wax can be applied in circular patches on each finger, starting with the thumb across to the little finger. 14. Once each finger application is completed, you will be ready to remove the wax in the same order. 15. Apply aftercare by grasping the hand and applying the soothing lotion in long strokes up to the elbow and back down to the hand, followed by a hand and finger massage. Proceed to the second arm. Procedure 11-10. Perform arm and hand waxing with soft wax. Time for this service: lower arm wax should take approximately 20 minutes, whole arm including hands, 30 minutes. 1. Have the client sit on the side of the table and remove clothing from arms, exposing the area to be waxed. Complete draping by offering a disposable plastic apron or placing a drape across the client's lap. 2. Apply the pre-treatment for soft wax. 3. With the client holding the arm outstretched with the palm facing up, start by waxing hair on the inside of the lower half of the arm, toward the wrist, where there is less hair. The hair grows downward toward the wrist, so the wax is applied following the growth and is removed against the growth. 4. Apply the wax strip and rub firmly 2 times in the direction of hair growth. Hold the skin taut and remove the wax strip in one quick pull. The next section to wax should be just above the previous section. 5. Next, the client should turn their still outstretched arm so the palm faces down. Then hold the arm firmly in place and start at the wrist, applying the wax the width of the strip across the top of the arm from the inside, thumb side, to the outside, little finger side. Follow the rules of application and removal. 6. Continue in strip size sections all the way up the forearm to the elbow. 7. Next, have the client hold the arm straight up, bent at the elbow, and apply the wax to the side that follows down from the little finger. This can be done in 2 sections. The hair grows down toward the elbow. 8. For the upper arm, ask the client to relax the arm and allow the forearm to rest on the lap. Apply wax in the direction of growth, which is downward toward the elbow. Remove the hair in sections starting toward the elbow and working up toward the shoulder, blending if necessary at the top. If waxing only the arm, apply aftercare. 9. To continue to the hand wax, ask the client to form a fist by tucking the fingers under, as this tightens the skin. Apply the wax with the growth, down toward the fingers, angling out slightly toward the little finger. The entire top of the hand can be done at once, not including the fingers. 10. Apply the strip over the entire area and rub firmly in the direction of growth. As the client's hand is floating without solid support, it is important to have a good grip on the hand when you pull quickly back against the growth. Apply pressure after pulling off the wax strip. 11. If the fingers have hair that needs to be removed and it is minimal and soft, it can often be removed with the wax that is already on the strip. The hair grows toward the middle knuckle, so take one finger at a time, press the wax onto the hair, rub in the direction of growth, and quickly pull off against the growth. 12. If the finger hair cannot be removed by pressing the wax-saturated strip, complete the process by starting at the thumb and applying wax to each finger, then quickly going back and removing it. 13. Apply aftercare by grasping the hand and applying the soothing lotion in long strokes up to the elbow and back down to the hand, followed by a hand and finger massage. Proceed to the second arm. Procedure 11 to 11. Perform a men's chest waxing with hard wax. Time for this service, approximately 30 to 45 minutes, depending on the amount of hair to be removed. 1. Complete draping with the client undressed from the waist up and fully reclined. Trim hair that is longer than 12 inch. 2. Brush away the trimmed hair clippings, cleanse the skin and apply the pre-treatment for hard wax. 3. Using a large applicator, apply the wax on the furthest lower outer edge of the area of the chest where there is minimal hair. 4. For expediency, a second wax application can be done while waiting for the previous one to set, as long as it is not immediately adjacent. 5. Remove the wax. Apply gentle pressure immediately after each pull in this sensitive area. 6. Move in sections upward and inward. As you get to the denser areas, be mindful of changes in the direction of hair growth and make sure that the hair is well coated in wax. 7. After completing the furthest side, continue in the same manner on the nearest side, beginning at the lower outer edge with less hair. 8. Next, turn your attention to the hair growing in a different direction in the center, again starting where there is less hair, usually lower on the chest, and moving toward more dense hair, usually in the center and higher up on the chest. 9. After hair removal is complete, finish by applying and massaging a soothing wax removal lotion to the area and checking for blood spots before the client dresses. Remind the client that blood spots are normal where hair is coarse and grows deep and that they are a sign of a successful epilation, not a cause for concern. Procedure 11 to 12. Perform a men's chest waxing with soft wax. Time for this service, approximately 30 to 45 minutes, depending on the amount of hair to be removed. 1. Complete draping with the client undressed from the waist up and fully reclined. Trim hair that is longer than inch. 2. Brush away the trimmed hair clippings, cleanse the skin, and apply the pre-treatment for soft wax. 3. Using a large applicator, apply the wax on the furthest lower outer edge of the area of the chest where there is minimal hair. The application should be no larger than the 3x9 removal strip. 4. Rub the strip in the direction of the hair growth and remove the strip against the growth and parallel to the skin. Apply gentle pressure immediately after each pull in this sensitive area. 5. Move in sections upward and inward. As you get to the denser areas, be mindful of changes in the direction of growth. 6. After completing the furthest side, continue in the same manner on the nearest side, beginning at the lower outer edge with less hair. 7. Next, remove the hair growing in a different direction in the center, starting where there is less hair, usually lower on the chest, and moving toward more dense hair, usually in the center and higher up on the chest. Wax this area in smaller sections, paying attention to the most dominant direction of growth or switch to hard wax in those areas. 8. After hair removal is complete, finish by applying and massaging a soothing wax removal lotion to the area and checking for blood spots before the client dresses. Remind the client that blood spots are normal where hair is coarse and grows deep and that they are a sign of a successful epilation, not a cause for concern. Procedure 11 to 13. Perform a men's back waxing with hard wax. Time for this service, approximately 30 to 45 minutes, depending on the amount of hair. 1. Complete draping with the client undressed from the waist up and fully reclined face down. The face should be in a face cradle with a disposable cover or with the forehead resting on the hands with the elbows sticking out. For comfort, you could place a bolster or rolled towel under their feet. 2. Cleanse and complete the pre-treatment preparations for hard wax. While cleansing, familiarize yourself with the directions of hair growth on the client's back, the length of hair, and inspect the back for skin tags, moles, and lesions. 3. If the hair is longer than 12 inch, it should be trimmed. Afterwards, wipe away the trimmed hair with an aesthetics wipe, and then apply a dusting of powder or pre-treatment recommended by the hard wax manufacturer. 4. Using a large applicator, first apply the wax on the outer edge of the torso, just above the waistline where there is minimal hair. Apply the wax in a manageable strip of approximately 2x5, using the application rules for hard wax. 5. For expediency, while the wax is setting, another application can be made, not immediately adjacent to the first application but one section over. 6. Remove the sections following the rules for hard wax removal. Immediately apply gentle pressure to the area. 7. Go back to the in-between section for the third application. Then, while it sets, apply the fourth application to the area immediately adjacent to the second application, and so on. 8. Continue in this manner until the side is cleared, following the waxing rules and directional changes. Include the back of the shoulder, if requested. 9. Repeat on the opposite side. 10. Next, wax the hairs growing down the center of the back, over the spine. 11. Apply aftercare of antiseptic lotion to the area that was waxed to remove wax residue, using effleurage massage strokes and being careful not to extend beyond the treated areas, as there may be a few more hairs to remove at the top with the client sitting up. 12. The client should sit up, facing you with their arms at their side and a drape on their lap so the rest of the shoulder area can be waxed. These sections are smaller, so wax one surface at a time to avoid waxing over a curve. 13. Make sure both sides are balanced and even. Waxing the front is considered a separate service, part of the chest wax. Apply aftercare to the remaining areas. 14. After wax residue is removed, apply a cool compress soaked in a baking soda solution for a few minutes. Remind the client that it is not unusual for hives to develop in the waxed area and they will settle down within an hour or so. Applying a salicylic acid product to the area can help reduce redness and bumps. As the client cannot see the back, let the client know when the blood spots have diminished before getting dressed. Procedure 11 to 14. Perform a men's back waxing with soft wax. Time for this service, approximately 30 to 45 minutes, depending on the amount of hair, and whether soft wax and speed waxing is used. 1. Complete draping with the client undressed from the waist up and fully reclined face down. The face should be in a face cradle with a disposable cover or with the forehead resting on the hands with the elbows sticking out. Waistband and undergarments should be protected with disposable towels. 2. Cleanse and complete the pre-treatment preparations for soft wax. While cleansing, familiarize yourself with the directions of hair growth on the client's back, the length of hair, and inspect the back for skin tags, moles, and lesions. 3. If the hair is longer than 12 inch, it should be trimmed. Afterwards, wipe away the trimmed hair with an aesthetics wipe, and then apply a dusting of powder. 4. Begin the hair removal at the area just above the waistline of the pants using a large spatula. The first application of wax should begin from the outside edge of the torso where hair growth is minimal. 5. Follow the standard rules for soft wax application and removal. Grasp the strip, hold skin taut, and quickly pull parallel against the hair growth. Apply gentle pressure immediately after wax removal to ease any discomfort. 6. The next application should be immediately above the previous one, photo A. 7. Repeat this process until you reach the top, towards the shoulders, as this is where you'll notice a change in hair direction. It begins to turn downward in the center along the spine. 8. Complete the removal on that side by following the waxing rules and directional changes. Include the back of the shoulder, if requested. 9. Repeat on opposite side followed by the hairs growing down the center, over the spine. 10. Apply plenty of soothing antiseptic lotion to the area that was waxed to remove the wax residue, being careful not to extend beyond the treated areas, as there may be a few more strips to do with the client sitting up. 11. The client should now sit up, facing you with his arms at his side and a drape on his lap so the rest of the shoulder area can be waxed. 12. The shoulders are waxed one surface area at a time. Do not attempt to round a curve with the strip. The hair on the shoulder usually grows inward to the center of the shoulder from the back, and inward toward the center from the front. 13. Finish by blending toward the front and top of the arms, using existing wax on the strip and making sure both sides are balanced and even. Waxing the front is considered a separate service, part of the chest wax, but blending a little with wax already on the strip is acceptable. 14. After all wax residue is removed, you can apply a cool compress soaked in a baking soda solution for a few minutes. Applying a salicylic acid product to the area will help reduce redness and bumps. Inform the client when the blood spots have diminished before getting dressed. Procedure 11 to 15. Perform an American bikini wax with hard wax. Time for this service, approximately 30 to 40 minutes, depending on the amount of hair to be removed. 1. Complete draping by providing the client with disposable bikini bottoms or protecting the client's own undergarments with paper drapes. The client should lay face up flat or semi-reclined. Cleanse the area to be waxed. 2. With an applicator select the hair to be removed, forming clean, even margins on both sides and keeping hair not to be removed securely tucked away and protected from the wax. 3. If the hair is longer than 12 inch, it should be trimmed. 4. Apply the pre-treatment for hard wax. 5. Ask the client to place the sole of the other foot to the level of the knee on the straight leg. The client should place one hand firmly on the paper or disposable panties on the pubis, fingers straight down. The other hand is placed on the outer edge of the thigh of the bent leg to help pull the skin taut. The hands in bent leg are reversed for waxing the opposite side. 6. With a large applicator, apply the wax following the panty line up to the femoral ridge in a wax strip 2 inches wide and 4 to 5 inches long. Follow the rules for hard wax application, leaving a thicker tab at the end nearest the femoral ridge to grasp for the removal pull. If this area of hair is wide, it may take 2 parallel applications, so begin on the outer edge and work inward. 7. Remove the wax, following the rules for hard wax removal and immediately applying pressure to the area after the removal pull. 8. The next application is downward from the ridge toward the table, leaving enough space for hand placement to hold the skin taut. To facilitate this procedure, have the client bring the sole of their foot a little higher to just above the knee. 9. Next, have the client lift their leg to their chest, grasping it behind the knee or drawing it across the abdomen, holding it by the ankle. This should expose the last remaining third of hair that was too near the table to apply the wax. This position also ensures that the skin is nice and taut. 10. Apply the wax initially upwards, coating the underside of the hair, then back downwards over the top of the hair. 11. The removal pull for this application is upward. When the first side is completed, continue on the other side. 12. Apply soothing aftercare and remind the client that blood spots are normal and acceptable in this area, and a visible sign of a successful epilation. Procedure 11 to 16. Perform an American bikini wax with soft wax. Time for this service, approximately 20 to 30 minutes, depending on the amount of hair to be removed. 1. Complete draping by providing the client with disposable bikini bottoms or protecting the client's own undergarments with paper drapes. The client should lay face up flat or semi-reclined. 2. With an applicator, select the hair to be removed, forming clean even margins on both sides and keeping hair not to be removed securely tucked away and protected from the wax. If the hair is longer than inch, it should be trimmed. 3. Cleanse and apply the pre-treatment for soft wax. 4. Starting with the side furthest away, have the client place the sole of the other foot to the level of the knee on the straight leg. The client should place one hand firmly on the paper or disposable panties on the pubis, fingers straight down. The other hand is placed on the outer edge of the thigh of the bent leg to help pull the skin taut. The hands in bent leg are reversed for waxing the opposite side. 5. With a large applicator, apply the wax following the panty line up to the femoral ridge in a wax strip 2 to 3 inches wide and 4 to 6 inches long, following the rules for soft wax application. If this area of hair is wide, it may take 2 parallel applications, so begin on the outer edge and work inward. 6. Remove, following the rules for soft wax removal and immediately applying pressure to the area after the removal pull. 7. The next application is downward from the ridge toward the table, leaving enough space for hand placement to hold the skin taut. To facilitate the process, have the client bring the sole of their foot a little higher to just above the knee. 8. Next, have the client lift their leg to their chest, grasping it at the ankle or behind the knee. This should expose the last remaining third of hair that was too near the table to apply the wax. This position also ensures that the skin is nice and taut. The soft wax is applied downward. 9. The removal pull for this application is upward. 10. When the first side is completed, continue on the other side. 11. Apply soothing aftercare and remind the client that blood spots are normal and acceptable in this area, and a visible sign of a successful epilation. Procedure 11 to 17. Perform a leg waxing with soft wax. Time for this service, approximately 30 minutes for half leg treatment, approximately 45 minutes for whole leg treatment. 1. Complete draping with client disrobed from the waist down and fully reclined on the table with legs stretched out and flat. If the feet and toes are to be waxed along with the legs, make sure they are kept warm with socks or a towel until ready to be waxed, or the wax will remain behind and not lift off with the strip. 2. To pre-treat the legs, mist the entire front area to be waxed with an antiseptic lotion, then dust the entire area with baby powder. 3. Have the client bend the knees and place the soles of the feet on the table. Then apply the mist and powder as far underneath as possible. For speed, prepare both legs simultaneously. 4. Begin with the leg and foot furthest away if you have to lean rather than switch sides. Give the foot a good rub with both hands until it feels warm. Apply the wax to the top of the foot, applying it downward toward the toes. 5. Apply the strip before the wax cools and pull off quickly as close to the skin as possible. Immediately apply pressure to the area. 6. If there is very little hair on the toes, the wax on the strip may be sufficient to remove those hairs by pressing the wax onto the hair and quickly pulling away, making sure that the pressure is in the direction of growth, and the pull is in the opposite direction. If there is considerable hair growth, apply the wax to each toe. 7. Rotate the foot outward. The next application is on the inside of the ankle. Apply the wax downwards toward the ankle beginning from 7 to 8 inches up the leg. Continue with the next application directly above the previous one. Proceed in the same manner until the knee is reached. 8. Rotate the foot back to the center and return. Then proceed again from the bottom, working in the same size strips, on the front of the leg up the shin bone to the knee. 9. Rotate the foot inward. Starting again at the bottom, clear the hair in the same size strips to the outer edge of the lower leg, again working up to the knee. 10. To wax the knees, have the client bend the leg and put the foot flat on the table. This area has coarse patches of dry, dead skin cells as well as folds of skin on some clients. This positioning ensures that the skin is tight. Apply the wax in downward, outward sections from the middle of the knee, covering the lower half. 11. Apply the strip, rub firmly downward, and remove quickly upward, working your way around the knee. 12. Next apply the wax to the top part of the knee in a downward direction over the top to the middle. Remove the wax strip. 13. Next move to the upper leg. If the upper leg is not going to be waxed, you are ready to move to the other leg. The direction of hair growth on the upper leg is downward in the middle and outward on either side. Lay the leg back down and have the client rotate the foot inward for easy access. Apply the wax just above the knee to the center outward. 14. Continue removing the hair by applying the wax from the center outward, moving up the thigh. It is especially important to hold the skin taut for the pull on the thigh, as the skin is often looser here than on the lower leg. 15. Rotate the leg back to the middle and apply the wax in a downward direction from 8 inches above the knee downward toward the knee. 16. After the middle is cleared, to wax the inner thigh, have the client bend the leg, bringing it to the same position it would be in if getting a bikini wax with the sole of the foot resting at the level of the knee on the other leg. Begin just above the knee, applying the wax from the inside down the inner thigh, leaving enough room near the table to hold the skin taut for the removal pull. Complete the inner thigh up to the bikini area, but not including the bikini unless that is part of this service. 17. Next have the client grasp the ankle or under the knee, pulling the leg to the chest to expose the hairs at the back of the thigh while tightening that skin for comfort and effective removal. Be sure the skin is held as taut as possible to prevent bruising. An additional dusting of baby powder may be warranted. 18. After completing the back of the thigh, move to the opposite leg, removing the hair in the same manner as on the first side. 19. When the hair removal of the second leg is completed, lotion should be applied to the waxed areas to remove any residue so that the client does not stick to the paper when she turns over. This can be done with both hands simultaneously. 20. The client now turns over for the remaining hair removal on the back of the legs. Have the client hang her feet off the end of the table and add an additional dusting of powder if necessary. 21. Begin at the bottom of the lower leg and apply wax over the calf from the outside inward, continuing up in the same manner to the back of the knee. 22. The hair growth pattern can vary at the back of the knee and should be determined at the time of waxing. Look for any patches of hair missed on the back of the thigh. 23. When all the hair has been removed from both legs, pamper the client by applying plenty of lotion and using gentle effleurage movements. Massage and soothe the legs with upward movements up the middle and a little lighter stroking down